Those of you that are struggling so hard to lose weight, please, you need to be very careful what you are taking, because this doctor has something very important to share with you. This is the Lucky Udo experience.
Nigerians dig their grave with their teeth because they eat lots of junk. The miracle of the human body is what science cannot even explain. God has made it so. Your body can heal by itself. 30 minutes of exercise 3 times a week is enough for the human body. Most people think that by taking slimming tea or taking something, you just lose weight all of a sudden. There are people that are like that. They look healthy on the outside, they look lean, but metabolically they are obese.
Do you know that the lady that has big bum is more confident than the lady with PhD?
People like Tonto DK. Her body is no longer there. So,
what happened? Doctor, you say that people who are very desperate to burn fat should be careful so that they don't ruin their kidney. What do you mean by that?
Well, most of those items they use to burn fat, like those drugs, weight loss pills and all that, slimming teas, they contain lots of laxatives. And what we mean by laxatives are, they are substances that are given to people so that they can purge, like they can go to toilet. That's what most of those drugs do. Either they vomit or they go to toilet. And the reason for that is so that the food that they consume does not, get absorbed into the body and build more fat. So by doing that, they are not really, the drug does not work by just affecting the human body directly. It works by making sure that the body does not absorb food into the body. So the complications of things like that are things like dehydration, because there's a way you go to visit the loo and you lose a lot of electrolytes that are needed in your body. Electrolytes like potassium, sodium, chloride, all these are very important electrolytes in the body. So when you go to toilet and you lose all these electrolytes, or you vomit and lose all these electrolytes, your body now has a depletion of these electrolytes. And when that happens, the person can have a serious complication from hypokalemia or hyponatremia. That is when you have low levels of these electrolytes in the body. It can even stop the heart, and cause sudden death. So all those things, we as medical personnel, we don't recommend all those slimming teas and weight loss that will give you lose 10 kg in less than 2 weeks or 3 weeks. That is very, very dangerous and very not advised. We don't advise people to lose weight. If you want to lose weight, there are so many ways of losing weight. You can go on diets, you can do dieting.
Does it work?
Yes, dieting works. You can do intermittent fasting, but you must combine these things with exercise. In fact, that is what we preach. That is the hallmark of what we preach as medical doctors. We recommend exercise, and exercise, at least 30 minutes of exercise 3 times a week is okay. It's enough for the human body. While you exercise, you should watch what you eat. Avoid high calorie diets. Like, we eat a lot of things in Nigeria. Like one of my lecturers will always say, Nigerians dig their grave with their teeth because they eat lots of junk, all these fast foods that we are seeing around, processed foods. We patronize them a lot. Gone are those days when people eat natural things, because everybody now wants to eat shawarma, wants to eat pizza, burger. All these things are very unhealthy for the human body. So avoid processed food, eat more natural foods, exercise, and you will lose weight. That's the truth. So we don't recommend all those slimming teas, weight loss, whatever, and Ozempic. I heard one they call Ozempic. I don't even know what that is, but it's not helpful at all. It won't help the human body. It's very dangerous. So that's just it.
How long have you been practicing, sir?
I've been practicing for like 6 years now.
6 years?
Yes.
Have you had people with, bloated tummy, pot belly, come to you for help? What are those recommendations to deal with pot belly
fat?
Yes, belly fat.
Belly fat is one of the most stubborn fat to lose. Like any fat around the truncal area, not just belly fat, both the hips and the back, the lower back. It's a very, very stubborn place to burn fat, unfortunately. That's why you see most people, especially the men, they always have what we call truncal obesity. That's what we call it, that belly fat, because The abdomen, which is the stomach, what we call stomach, we call it abdomen in medical terms. It has a fat inside, we call it the omentum, it's a fatty component in the abdomen there. And the stomach as well has a lot of fatty stores, So the problem is that when most men come to us that they want to burn belly fat, we also recommend exercise and dieting for them. But all those weight loss and slimming teas and weight loss pills are very dangerous, and most times they don't even work. Most times those things are just what we call placebo. What we mean by placebo, we mean that you are just taking it. Is the psychological effect that is going to happen to you, not even that the drug has any direct action to the body. Just like you take, maybe they can, if we do drug trials now, what we do in our field as clinicians is we use placebo as control. We use the main drug that contains the active substance. You'll be surprised that if you give people placebo, they will recover because they think that you are giving them the actual drug. You understand? So most of those drugs are just placebo, and it's for pharmaceutical companies and companies that produce all those drugs for them to make money, and all that, because most times it doesn't even work for people, and that's just the truth about it. Yeah, I've had people approach me, especially men approach me, that they don't like their belly fat and all that. But the truth of the matter is that these same men are not ready to cut down on what they eat, especially alcohol. And the truth is that what they call, they used to call it beer belly, or what they call it, because they drink a lot of beer. The truth is that alcohol itself contains a lot of sugar. That's what people don't know. All these drinks that we take as beer, alcohol beverage, they contain sugar. You'll be surprised that all this alcohol that we take has more sugar than our soda, Fanta, Coke, and all that. But because of the taste, people say, it's not have sugar, all those kind of a thing. But the people that brew the alcohol is fermented carbohydrates and fermented glucose. So people that produce it, they put lots of sugar so that fermentation, happens, and it gives you that, alcoholic effect when you take it. So that's the truth. And because of the sugary contents of those alcoholic drinks, once you take it into your body does not use all that sugar, because you have to be active. And if you're living a sedentary life, maybe you will go from office to office, from office to your home to your bed. You don't work out, you don't go for any exercise, from your house to your car, from your car to your office, from your office back to your car, then back to your house. You don't trek, you don't, walk, take walks. Those things are very helpful in helping you burn the excessive calories that get stored in your body and all that. So that's just it.
So, what about the place of rest?
Okay.
Yes, having sufficient rest. Because sometimes it's very, very possible that you have, like, to be very honest, I only eat once a day. Majority of times. It's unreal. I wouldn't say, I don't eat like twice or thrice very often. So on most days, I just eat once, usually around this time, 5 p.m. And, I'm trying my best to exercise daily, like taking long walks and all of those things. But somehow I have not been able to see visible changes. So someone close to me was suggesting that maybe it's because I am not having sufficient sleep. Okay. That when I'm having too many, when I'm stressed, it's building what they call, is it cortisol?
Yes, cortisol.
Yeah, so I don't know if this is something you want to talk about.
Yes, stress. There is a hormone in the body known as stress hormone, and that hormone is called cortisol. When you pass through any level of stress, whether work stress or you went for a surgery and you have surgical stress, or anything that makes you, get exposed to stress,
whether it's mental stress,
physical
stress, emotional stress,
physical, emotional, depression, financial, anything that makes your mind unease has the tendency and propensity to, secrete those hormones in your body. Now, what the body does is that cortisol is actually a compensatory mechanism. Is the body is trying to compensate for the level of stress you are putting the body through. And that's one thing about the human body. The miracle of the human body is what science cannot even explain. God has made it so your body can heal by itself, So when you are exposed to those level of stress, those hormones kicks in voluntarily, and what those hormones is trying to do is to trying to prevent inflammation, because cortisol is a steroid, and those steroids prevent inflammation. Because if you don't have those hormones in your body, you have inflammatory problems, and you start having. That's why at your young age now you don't have arthritis and all these joint diseases, because you are young, your cortisol levels are high and all that. When elderly people, it's not so. Their body is giving in, and that's why they are more prone to having arthritis and other autoimmune diseases and all that. So cortisol kicks in. And you asked if stress, you say you need to have lots of rest. Yes, the body needs rest, at least 8 hours of sleep every day. That's what is recommended medically. You should have at least 8 hours of sleep every day. But the truth about eating is that some people eat once a day, but that once a day is equivalent to some people's 3 times a day or 4 times a day. They may just eat eba with 4 shake, meat, plenty meat. They can eat 3, 4, 5 wraps of fufu. They have eaten once a day actually, but that their meal is actually equivalent to some people's 3 times or 4 times a day. So what you eat is what matters. It's not how many times you eat that matters. What do you eat? What is the component of your meal? So like I said earlier on, try and reduce the carbohydrates in your meals, the sugar, in your meals. Most of these carbohydrates that we eat, fufu, gari, all these things are what we call complex sugars, because by the time the body breaks down this sugar and store them in the body as as fats, you don't know that you are getting fat because of these meals. So things that you should eat are things more like simple sugars. Fruits, for instance, fructose is a more simpler sugar than these complex sugars. So your meal should compose basically more of fruits. You should just put little carbohydrates, little protein. Protein is very, very important, especially for children. But for adults, we are very, very keen on not putting too much protein in our meals. So more fruits and vegetables in our meals is going to help us, reduce weight. We should try and avoid junks as well. Junks are too processed. Salad cream, all these things are processed foods. It doesn't help the human body at all. So that's just it. Yeah.
Interesting. This is very, very interesting. So like he has said and explained, it is very, very important we are careful the things we put into our system. Pasta is really delicious. A lot of us can't even help it. But we have to reduce the intake of processed food. We should embrace more salad, fresh water, fresh juice, eat nuts. There are different types of nuts. Most of us only eat groundnuts and cashew nut, but there's macadamia nuts, there's pistachio, there's walnuts, different types of walnuts apparently. And we should get these nuts, eat healthy food. There are different types of vegetables, different types of fruits. We should embrace these kinds of food. When was the last time you ate pawpaw? As a child, majority of us used to enjoy pawpaw a lot.
Yes.
But these days, we are now grown to adults. We
hardly
spend
eat
our
fruits.
money on pizza, shawarma, burger, fries, and all those things.
So that will give you a lot of information. Like, for instance, now you see, at least mostly in our ladies, they are very, very conscious of their weight, because most of the single ladies believe that if they are fat, they won't find a befitting husband. So they are very, very conscious of their weight. And when you see them eating, most of their food is normally fruit salad. You see a lady will not eat for the entire day and may just have a meal of fruit salad just because she wants to lose weight. Well, why we don't recommend that kind of eating habits, because I've seen people collapse because they just ate fruit. They just, if you are doing a kind of job that needs you to have enough glucose in your body, fruits might not just be the option. You can mix your fruit. You can take maybe yogurt, maybe in little quantities, mix it with something that has glucose, because the human brain is an organ that loves glucose so much than any other part of the body. And that's if you have low glucose levels in your body, it is very dangerous. That's why you see people fainting when they come to occasions or these things, and people are rushing, blah 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 blah. They can have syncope, what we call syncope attacks. Most of them are due to hypoglycemia, low sugar. You see some ladies, they will tell you they have not eaten for 3 days. They are just eating fruit salad. Those things are not recommended. Then there's something I forgot to mention in that weight loss pills and weight loss slimming teas. There is this drug that we use when we want patients to lose weight, especially for very obese patients and for patients that want to lose weight, and we saw that their weight is very, very concerning, especially in all this overweight. We don't even have overweight people in Nigeria. If you go abroad, go to US, go to these European countries, see people weighing 300 kg, 400 kg kilograms in weight. When they meet their doctors give them drugs. There are drugs there's one we call Olistat. Now, what does this drug do? This drug prevents the digestion of fats, because you can't tell them to stop eating. They won't listen to you. Can't tell them to stop eating, because no matter how you try to educate your patients that food is going to kill them, they can't stop eating. It's an addiction. You understand? So you give them those drugs. Once they ingest those drugs prevents enzymes that break down the fat in the body. So the patient will just eat the food and it just go through the gut and they pass it as stool without it getting absorbed in the body. So that's what some of those drugs do. But you see, when things get into Nigeria, they get abused. People start commercializing it as if you want magic, you should go and buy those drugs and take it. Before you know it, in 2 months, the person has lost weight. There are so many celebrities that we saw that lost weight. They say they are using this, they are using that. Nobody knows what they did.
Exactly, like Ice Prince. Jesus. I was so shocked. Ice Prince said that he used to take walks every day, 1 hour walks.
Ice
I
Prince.
don't believe it. Can you take your phone and look at what Ice Prince looks like right now?
I saw the picture.
Okay,
I saw what Ice Prince. I didn't even know Ice Prince was overweight before, because he has not been.
He wasn't even really looking overweight. He has always been the way he is.
Yes, Ice Prince.
It was only when we saw the recent one that we understood that
there was a difference. Not just Ice Prince, even this Opeyemi, that the food critic. I don't know if you discovered he had a very drastic weight loss.
No, I haven't noticed.
Opeyemi lost weight too, because I think what made him lose weight, that it should be a motivation. I think what made Opeyemi lose weight is that he went to the hospital and they told him he had hypertension. And hypertension is caused by weight gain. That's the truth. If you start gaining weight now, your blood pressure starts shooting up. I think that inspired him to start going to the gym and start, dieting. It was a combination of both. It helped him. He had a coach,
Why are you saying this like you were there?
No. The thing is that most people think that by taking slimming tea or taking something, you just lose weight all of a sudden. You understand? You have to combine it with what you are supposed to do, which is exercise.
Exercise, which is very important.
Very, very important. Whether cardio, especially cardio.
What's the best form of exercise for weight loss?
Cardio.
What's cardio?
Cardio is taking walks, running, jogging. That's what cardio is.
Okay.
Using the treadmill. You are moving, you are burning fat in every part of your body.
It's not just concentrated in one.
No, not just concentrated in one part of the body. When you exercise, what the body does is it goes into what we call a catabolic state. Catabolism means breakdown. The body starts breaking down these fuels that you have stored in your body for a long time. Because it's just like your body is just like a reservoir, just like a petrol station or a gas station. If you store fuel in that gas station and people are not coming to buy fuel, what happens? The fuel will remain there till anytime someone comes to buy and use the fuel. So that's how the body is. All these things we eat, the body stores it as fuel, and it is expecting you to use the fuel. But most of us don't use it. From the sedentary lifestyle in this century is very, very high. You can stay in your house, order boats. By the time you step out of your door, your boat is waiting. You have entered your boat. Gone are those days when they used to trek, when you would trek from your house to bus station or bus park. And that's why if you go to cities like China, you hardly see obese people there. You have not asked yourself, what are they doing in China? In China, they encourage people to use the bus stations, train stations. They have bicycles. You know,
they have a lot of staircases.
They have a lot of staircases. They have so many things that will make you take that necessary walk, even if it's 5 minutes, 10 minutes walk. And we encourage people that if you don't have time for exercise, because people these days are very busy, very, very busy. See what you do. If you go to your workplace, park your car far away from your office, you know, then come down from your car and trek to your office. That is exercise. That is going to be very helpful. You may think that it's not doing anything for you, but it's helping your cardiovascular system, because the heart is something that benefits from exercise more than any other part of your body. The heart. You understand? And exercise as a whole helps the whole body, even sexual life. Exercise helps sexual life. You know, you see men complaining of premature ejaculation, they don't have libido. You see the women complaining of low libidos because they don't exercise. In fact, research has shown that people that go to gym the more have higher libido than people that don't go to gym. It's something that has been proven. So, and it's very obvious why the body needs exercise. That's the truth. Yeah.
Exercise is very, very, very,
very
important.
Paramount. In fact, exercise is one of the first things we recommend for people with hypertension. We call it lifestyle modification. When you come and your blood pressure is shooting between 130 and 140 over 80 to 90 or 90 to 100, we first of all recommend exercise. We call it lifestyle modification. Your diet, reduce your salt intake, reduce fat in your diet, eat more fruits and vegetables, and exercise. Once you start doing those things, your blood pressure will start shooting down. Because, okay, what happens in hypertension? The vessels become very tiny. And what is making the vessels tiny is fat. Fat enters the arteries and start clogging them, narrowing the arteries. It's just like a pipe. Now you have sludge in the pipe. You must go and clear those sludge, because at a time the pipes get what? They get blocked. And that's what happens to the heart. Once the arteries in the heart are blocked, you have what we call a heart attack. So that's why people with hypertension are prone to having a heart attack. So once you start exercising, the fat stores in your body starts depleting with a very significant momentum. And by the time you do all those things, you become healthier, you feel good. Aside the physical benefits of exercise, mentally too, exercise has helped. It has helped people that have anxiety and panic attacks. We recommend exercise for them. So that's just it.
Oh, interesting.
Yes.
So I do 1 hour walk every day.
Okay.
I want to know what is too much and what is not enough.
Okay.
Because I'm currently 114 kg and I'm trying to
cut down.
Cut down to reduce to like maybe 90 kg. So what I'm looking to lose is like 24 kg.
24 kg.
So what would you recommend that I do to achieve this in maybe 2 months?
2 months.
Or should I say 3 months?
Well,
or let's say from now to January 1st.
From now to January.
November. So that's like 2 months though.
2 months. Okay.
Or January ending.
You know, there are people that are experts in nutrition and sports medicine. They calculate like your body weight now. What they do is that they calculate your body weight, divide it by the timeline you want to lose weight, and they'll tell you how many calories you must burn per day.
Why taking a certain level of food, Abby?
Why taking some certain level of food? In fact, bodybuilders are so judicious to their nutrition. They calculate the protein they take every day, the carbohydrates, the fats. They calculate it. You understand?
Yeah. Doctor, I'm very confused about something. I saw a video on TikTok of a guy eating a large amount of bread with so many eggs. The quantity of food this guy consumes is a lot.
It's concerning.
Yet, he doesn't look overweight. How does this even make sense to you?
Now, what I actually thought that guy was doing was, I didn't think he was finishing that food.
You've seen the video?
I've seen the video. I know the guy on TikTok. In fact, I made a video about him because he went for an occasion and his feet was swollen. That was very concerning for us doctors. Once you see your feet start swelling, it doesn't look.
It's a sign of
something sinister happening in your body that you need to pay urgent attention to. That the kidney or the heart is having issues. So, why he may not look overweight physically to you, there's what we call metabolically obese, normal weight individuals. If I take blood from that guy's body and check the lipids in his body, the cholesterol, it may be very shocked at what it might be because of the amounts of food I eat. There are people that are like that. They look healthy on the outside, they look lean, but metabolically they are obese. So it happens, some people don't put too much size when they eat. It's very normal for those individuals, but we need to find out what is happening in the body. So in such cases, that's why if you come to the hospital, you're overweight, we would like to do what we call a fasting lipid profile. It's a test that we do to check the amounts of cholesterol, the TGs in your body, the good fat and the bad fat. If you have more levels of good fat, healthy for you, better for your heart, better for your for the amount of years you have to live on earth. But if we check and we see more bad fat, we have to start you on some medications and also advise you on your lifestyle. So he's young. That's one of the things also that is helping him. His body is still fighting, trying to, resist anything that food might have done to his body and anything. So, I don't wish ill on anybody, but I will tell him that he should stop. It's not going to help him at all.
If you even look at his earliest videos, you'll find out that he was not always that way. This guy was looking
very lean.
Very lean.
So he's adding weight.
So
now.
This happened within a month, less than a month.
Started adding weight.
He started adding weight. And I don't think he's even eating as much as he used to anymore.
Yes. Okay.
Because I saw a video where he went for a competition and they served food. He barely ate. Instead he was dancing. He was, and it was really amusing watching him.
Yes.
But I was worried to an extent. You see this thing called attention.
Yes.
Fame.
Validation.
The people cheering him up now, they'll still be the ones to judge and tear him down if something bad should go wrong.
People do extreme things for social media validation. And if you are doing it at the detriment of your health, I don't know what that person's plan is in life. Some people, you tell them, they'll say it's their passion, is what they want to do. They feel. You see people climbing skyscrapers, to get validation. You see people doing extreme sports so that they can get famous online and all that. Well, we doctors, what we do is always we advise. People make decisions that affect their lives, and you can't change that. We can't interfere. We can only advise and say, look at what is going to happen to you. We do what we call the carrot and stick approach. Say, if you continue doing this, you may likely, pass on. Or if you do this, you become better. So that's the approach we use when we advise people about that. I've seen him, that swelling of the feet may be an early sign that he should stop eating that thing that he's eating, because one thing that food does to the human body is that it causes what we call insulin resistance. Insulin is a hormone in the body that when you take sugar, the insulin breaks it down, breaks down the sugar and, makes it absorbed into the cells, But if you are having insulin resistance, it means that you'll be taking sugar and it'll just be flooding your blood.
It won't break down. So what can you do about it? Because I suspect that might be what is happening to me too.
Okay.
Because this belly doesn't ever go down. So there was a time that I stayed for 3 days. I tried not to eat. I was just taking water and see if I can remember clearly. And the moment I ate something,
there are people that they have insulin resistance, and so when you have insulin resistance, mostly the person ends up being type 2 diabetic. That's what we call diabetes mellitus. because there's insulin resistance in diabetes. In fact, that's what we call
I
diabetes.
reject it too.
We reject it.
I don't have it, but I just suspected that maybe I did. Because I just figured out that I was having difficulty losing belly fat.
You know, that's the thing. That's why I said is one thing with belly fat is once you get it, it's hard to lose it.
I won't come out this thing.
That's why people go extreme.
Go for surgical operations.
Go for liposuction. Go to remove the fat. But you know, surgery also has its own perks and disadvantages.
Can you tell us about it?
You can have complications from surgery.
What kind of complications?
Number one complication from surgery that surgeons are afraid of is infection. Infection. That's number one complication.
How bad can it get if someone gets infection?
Infection, you know, when you put a foreign object in the human body, you have created a portal for microorganisms that are not there to enter. That's one thing about surgery. That's why you see a surgery, they prepare for it like they are preparing for war. You have to be prepared for worst case scenario. So we make sure that the environment is sterile because of these organisms. But then humans, we are working with a lot of organisms on our body. Our mouth, our skin contains lots of organisms. Our gut contains lots of bacteria. You know, when you do a surgery, your expectation is that the patient will recover without having any complication. That's the expectation of every surgeon. But sometimes things can go south and the patient may have very serious surgery. I don't know if you have seen people with all these butt implants and liposuction that did Brazilian butt lifts when they have a surgical infection. It's very bad.
It's very bad. Yeah, I've seen those videos.
You see a lot of abscess, pus
coming out.
They keep draining pus.
But I wonder how these things work. How is it that someone that does not have bum will go for a surgery, all of a sudden the person will have bum that is very big, very soft? How does it happen?
We thank our plastic surgeons and reconstructive surgeons.
How does it work?
See
that
what
big
they do.
Thing that is soft, is it part of the real bum?
Yes,
it's real bum, but they'll expand it.
Now let's look at the anatomy of the human body first. What is in the bum? Like if I bring out your bum now and cut it open, what will I find? I'm going to find a lot of fat there. That's the truth. Before you now get down to the muscles. The muscle on your bum is one of the biggest muscles in the body. We call it the gluteus maximus muscle. Now in women have exaggerated amount of fat than men. In fact, they have more fat than men. Men have more water than women and more muscle density than women. So in these surgeries, what the surgeons normally do is they just do what we call, like in Brazilian butt lifts, what they do is they do fat transfer. They take fat from your thighs, your stomach, and put it in your butt. That's why I see many people that do BBL, they have tiny legs because they have sucked out all the fat from their laps, from their thighs, from their stomachs, and put everything in their butt and transfer it to the butt. And they do what we call body sculpting. They sculpt, not just do the surgery, they sculpt too. You see people that had this surgery, what do? They use compression bandages, they use corsets, and tie the body for a while. What they're trying to do is so that the body will adapt to that shape, so that the fat will stay in those positions that they have kept the fat. Why many people do that kind of surgery with fat transfer, which I feel is safer than doing implants. Because in implants, you're not taking something that is foreign to the body and you're putting it there. Or putting butt implants or whatever you're putting there. You know. Why I don't like implants is that implants have a lot of long-term complications. An implant can rupture, can just burst. That's why you see most of these people that did butt lifts. I don't know if I can mention anybody's name now. People like Tonto DK, she had her butt is no longer there. You know. So
what happened?
They won't tell you what happened. They removed it now. She had to go in and they remove it. Because one thing with butt implants is that you have to be going for what we call revision surgery every now and then. So it's expensive to do and it's expensive to maintain. You know. So they have to go in and be doing revision surgery because those implants that they put in the butt, for those that did implants, start shrinking. They start causing what we call scar tissue formation around the butts, around the implants, and start forming fibrous tissues. So as the implant is there, but the skin around the implant is shrinking. So the thing will be losing symmetry. You see one nyash is bigger than the other nyash with time. So once they see it, the cosmetic purpose of putting the butt there, the implants there in the first place is defeated. So you have to go and remove it and do a revision surgery. Some put another one. Some just, they have lived their life, they are prime, they are okay, that they have shown people they have bought. You stop seeing them on camera, they just disappear into oblivion. You won't hear from them again. But you still have generation of people that just do their own. They come to limelight. So that's the way the thing does. Nobody carries an implant forever. That's the truth. Nobody carries an implant forever. Fat transfer is more something that can last for a long time. Better for you, because you're not putting anything in your body that is foreign to your body. So fat transfer is better, but sometimes fat transfer fails. But now we have a lot of sophisticated equipment for this surgery now in Nigeria. Before, we don't have these things in Nigeria. Now you go to Port Harcourt, you have many of them. Abuja here, you have many of them.
Yeah, what surprises me most is that most of the facilities where they do these surgeries are not even clinics. They are spas. I went to a spa recently in Abuja around Wuse, and I was surprised to see that they told me they could do a surgery to get rid of tummy fat. But the facility actually looks like a place where they have all those things. Yes. And they were also talking about boobs, and butts. Like, I was so shocked. So I used to think that it has to be in a clinical facility, but not in a spa. Yes. So they call it a beauty spa, and they take care of things like this. Does this make sense to you?
Doesn't make any sense to me. Those places are slaughterhouses.
What if they actually employed a certified surgeon there?
There are no certified surgeons there. The people that you see, they are quacks. They are people that, I don't know where they got their knowledge from, but what they are doing there is very harmful. They are killing people in those spas, but nobody will tell you. Nobody will tell you what is going on. You see a woman do a breast implant, do breast augmentation in a spa. What are the aseptic techniques that they are observing there? Because if you are doing because those things are surgeries, how are they making sure that infection does not happen in those areas? Are they observing aseptic? Because I've seen most of those spas online. I don't think there is any aseptic technique in whatever they are doing. That's not my number one concern. Then my number two concern is the skill and the surgical expertise of those people. Yes, you may find them, you may see that they are gaining results. You see most of their patients coming to testify that yes, they are working fine and all that. But what happens after all those things? What happens? Some of them have very bad infections. Like I said initially, some of them have very bad infections because of the structure of the place and the expertise and skill of whoever that is doing that. But they are not, I'm very sure that they are not medical doctors there. If you must do a cosmetic procedure, it should be in a hospital, because it's a surgical thing. It must be within the walls of a hospital where they observe appropriate. There are things we call principle of surgery. You must observe appropriate aseptic techniques. The surgeon must be skilled, must have gone for training and become what we call plastic surgeons and cosmetic surgeons, because there are so many things in the world of surgery that people, all these quacks, they think they know so much, but when they run into trouble, you won't see them again. They run. Patient suffer. The person that had the procedure will bear the brunt of the whole thing alone. So those quacks, I think they should be, they should find out what they are doing in those places and possibly put regulations on because most of these beauty spas, they didn't start with doing butt implants. They started with doing body sculpting. Some of them say they wash your skin for you, scrubbing. They started with all these facial massages, teeth whitening and all that. But those things, are they safe? No, they are not. It's not helpful at all.
May God help us.
God will help us, but the thing is that in Nigeria, people are doing a lot of things to survive.
And that's because the society is setting unnecessary standards, beauty standards. Do you know that the lady that has big bum is more confident than the lady with PhD?
That's just the horrible truth.
You know, it's the standard that the society has set, beauty standards.
You know.
Some ladies have to wear, there's this tight that has foam.
Okay.
Some ladies are no longer confident to be themselves anymore. So they feel like they have to wear this to feel accepted.
They feel accepted, yes.
And it doesn't really make sense. When I see people like this, I feel so sad for them because they are losing themselves. That is not who they truly are.
That's what we call body dysmorphia. In body dysmorphia, it becomes a mental problem. You are not satisfied with the way you look. I don't know if you have seen some people. Well, it's not common in our country because there's nobody that is ready to spend $50,000 doing cosmetic procedures. You know, in body dysmorphia, you have people that spend up to that, even more. If they do their lips, they say, "Oh, my nose doesn't look good." They do another nose job. See, I don't like the way my nose is too pointed. I want this side to be flatter than this side. Once they do that one, they say, my shoulder is too down. I want to elevate my shoulder. You know, they keep doing. One thing about cosmetic procedures is that you're never satisfied with the outcome. You know, and that's why plastic surgeons they go to the bank on such kind of patients. You know, every year they're having one procedure or the other. You know, doing something to their body because they are not satisfied with the way God made them. So that body dysmorphia is a problem. That's another problem with plastic and cosmetic procedures. I know it can be bad. People die from surgeries. You know, we have very prominent people that died because they went to do a nose job. You know, we know someone that was very popular. A memorial was done recently. She went to, I don't know where she went to, Egypt, maybe Turkey. Died. The thing is that there's what we call anesthesia. I don't know if you have heard about anesthesia. Yes, they put you to sleep. You know that drug can kill you.
Are you serious?
Yes.
Even if you are going for common, like I've done endoscopy like twice. Yes. They do give that thing to me. I fall asleep.
That drug can kill you.
Are you serious?
Yes. It's called anesthetic accident.
But there are specified doctors that handle. Specialists that handle
That's
it.
why there are specialists that handle it.
But just anybody cannot just handle it, right?
I've seen cases where experts do it and the patient dies on the table.
Jesus Christ. Didn't I've done that in I did a surgery this year. They did that to me.
Okay.
And even all the times I did my endoscopy, it was done to me.
Yes.
And the thing is that once it's happened, they'll say count 9,
good,
8, 7.
And that's why they attach you to a monitor to be looking at your heart rate, and your vital signs.
It will be beeping and everything.
That drug is very strong. You know, and the thing is that most people do not know.
Why did you tell me this now?
I'm not saying it to scare you, but I'm just telling you the reality. In fact, when you sign a consent form from surgery, I'm not trying to instill fear in anybody. Many people can quote me for what I said. I'll still defend it. When you sign a consent form for surgery, do you know that in the case or event of a death, because one of the complications of surgery is death. We don't tell patients that so that they don't get scared and say they are not doing the surgery again. But in that consent form, it's a legal binding that if anything happens to you during that surgery, that the hospital can never be held liable. Have you seen any hospital prosecuted because the patient died on the table? No. So it cannot happen. So if you die, they say it's a complication from surgery. Anesthetic accidents happen.
Somebody will sleep and not wake up.
I've seen a case where they just injected the guy to start surgery. Next thing, the person arrested.
What is arrested?
The heart stopped. The heart stopped.
Was the person shaking before it stopped?
Well, did the patient really shake? Well, the monitor was beeping, you know, all those alarm signs were blaring.
Once it starts, is there a way to recover the person?
Yes, most times we'll do CPR and we'll do what
and the person will wake up.
Yes, I'll do a defibrillator and use maybe the heart enters into arrest. You know, the heart become ventricular fibrillation or any arrhythmia that happens in the heart. We can shock the patient. You can do a defibrillator and shock the person back to normal rhythm. You know, most times we don't succeed, and you hear that the person died. You understand?
Yeah, go see the shock more.
But the problem that we have in Nigeria now is that most hospitals don't have those machines.
That's the problem.
That's the problem.
Is it not risky now undergoing all these surgical operations on innocent patients who do not know or have this level of awareness, knowing that you don't have emergency equipment to bring them back in case of complications?
That's the truth. If you look at a typical ambulance in a hospital, do you find those machines there? You may not find them.
These ambulances are just almost empty.
They are empty. They are vans. They are not ambulances. They are vans. They just use it to convey patients from place to place. You don't have those equipment.
I heard ambulances are very expensive.
Very expensive to maintain.
Even to purchase.
To purchase them too is very expensive.
Like how much? 500 million?
I wouldn't know, but they're expensive.
Because I heard there was a time government was trying to get some ambulances. And I heard like one ambulance is like, is it 500 million? I'm not so sure. I was like, how much is now Rolls Royce?
Trust government now. They'll find a way around it.
Can we quickly just check?
Okay.
Online.
How much they sell an ambulance?
Yes, let me just... How much is an ambulance?
Depends on the company producing them. I think most of the German-owned companies should have better ones, better ambulances.
It's around $100,000 to $250,000, but then there are some that are very they say it's between $150,000 to $350,000.
Wow.
So $100,000 was like 150 million. So that like is between 200 million to, like I said, up to 500 million.
It depends on how equipped the ambulance is.
There are different.
There are different ambulances,
sizes and everything, right?
The ambulances that have oxygen tanks, the ambulances that have this machine I mentioned, the defibrillator or synchronizer, DC synchronizer. There are some ambulances that even have you have a stretcher. You have the ones that have two stretchers. There are one with one stretcher. There are one with straps. There are some without straps and all that. So I think depending on how equipped the ambulance is, it's going to determine the price. Most of the ambulances I've seen don't have oxygen tanks. You have to transport oxygen externally. You have to put oxygen tanks inside, transport your patient and all that. Some have a monitor, where you can monitor the patient's vitals and all that. Some have ECG machines. So it depends on how equipped your ambulance is. I think that will determine the price of the ambulance. Some buy cheaper ambulances and equip them themselves, and all that. So it depends.
Doctor, it's so sad that in Nigeria right now there are so many hospitals that are not having standard equipment.
Yeah.
May God continue to help us. So honestly, I can't imagine what Nigeria is going to look like in 10 years. I mean, compared to what we have in other countries, if you look at what Japan is doing, those guys are completely ahead of the rest of the world.
The thing is that when a country have priorities, that's what happens. You need to ask yourself, how much is the federal government budgeting to health every year? That should give you an idea of whether the country wants the health sector to function or not. Many times government will come on the Senate and make proclamations and decree they want to reduce medical tourism in Nigeria. What are you doing to reduce medical tourism?
What is medical tourism?
Medical tourism is when people leave the country to other countries for health purposes. That's what medical tourism is.
Okay.
You want to have a transplant, you're going to Turkey for hair transplant from those jobs. What are they doing in Turkey that they can't do in Nigeria? No, that question should hit you. It should hit you. Is it experts? Is it machines? Most of these countries, they send their doctors abroad to learn procedures, to learn how to do these things. They sponsor them. Go and learn it. Come back to our country and build and create this awareness that we are doing things. Turkey is not a place that people used to go to before. Who knows about Turkey? But now if you mention Turkey now, you know that it's a hub for where people go to do cosmetic procedures. It doesn't mean that other countries are not doing it. But in Turkey, they have put so much attention on those areas that people are doing it. Not only are they doing it cheaper, they are doing it with so much ease. They are making it very, very attractive for people to come and do. When you go to Turkey, you don't get scared because you are doing a surgery. They put you in a 5-star hotel. Make sure you get comfortable. So it's not like the typical Nigerian hospital that you're having surgery, you're having palpitation, you're already having an anxiety. Oh, I'm going for surgery. They don't make it look like you're going for a surgery. They make it look like you came for vacation. So those are the things that the government can put in place in a country like Nigeria. Yes, we have very good private hospitals in Nigeria that are up to standard, but how many people can afford it?
True.
That is the problem. It's just for the elites. A typical Nigerian cannot afford the hospital bill of 100,000, 150,000 naira. Okay, what insurance policies have we put in place to help the typical Nigerian access healthcare? In America, they have Obamacare. Why is Trump fighting to bring down Obamacare? It's because they are spending so much money on Obamacare. People are having access to health like never before under Obamacare, and Trump is not happy. The money they are spending on Obamacare is enormous, but people are benefiting from it. You understand? So what are the insurance policies that Nigeria are putting in place? You are telling us NHIS that you will come, they will tell you that they will pay 10%, you pay the remaining. That's no insurance. If you want to help the people, put up insurance policies that will help them. Where government will say, I'm going to cater for your health needs. Just pay your tax. Those kind of a thing. So it's going to be a very lovely thing that because next year the president is trying to put in so many taxations and other policies that are going to be very, very heavy on the people. You should at least make health, something that is going to be palatable to people. I don't think that people are going to feel the heat of it and all that.
Well, may God help us in this country. Yeah, Doctor, you've spoken well.
God cannot come down to help us. We just have to have good leaders that are interested in doing the right thing.
There are certain situations you find yourself, you have to shout Jesus, because at that moment you feel that's the only supernatural being that can save you. That's what is
killing us in Africa.
But you don't believe in Jesus.
I believe in Jesus 100%.
Mm-hmm. So when you've had your you've had your hope on the government for so long, and it doesn't seem like, you just say, only God will save us. But of course, we know that we are supposed to hold government accountable, and government are supposed to also stay accountable as well.
Now, the doctors are on strike. Why are they striking? Because their salary is too small. In 2025, Nigeria is 67 years, Abi, how many years? And doctors are still striking because of salary. It's a shame. Doctors should not be striking because of salary. If doctors must go on strike, they should go on strike that we are tired of doing some archaic things in our practice. Doctors should go on strike because they don't have a vein finder in the hospital. That should be one of the reasons why we should go on strike. Not because of pay. We should grow past that by now. So those are the things, those are the important things that government should look into. If they can do those things right, our health system needs to improve. Because if you put something in place and then the nurses or the doctors or any part of the medical professional team is going on strike, it means that things are not being put in place, and it's going to set the health sector backwards. By the time doctors start coming back from their strike, they'll start have to get patients to fill up the wards and all that. It's not helpful at all. So that's the truth.
You just mentioned something about doctors are not supposed to go on strike because of salary.
Yes.
That doctors should go on strike because of certain things that are not in the facility.
Yes.
Like you mentioned, vein finder.
Yes.
I am curious to know what other things are not available in some of our hospitals.
There are so many things.
Like what?
So many things. Hospital beds. Do you know something as common as a hospital bed can affect the recovery time of a patient?
Mm-hmm.
Yes. Do you know that? There are some beds that we have now in hospitals that once a patient lie on those beds, they can never have bed sores. There are beds that are equipped, like we call them mattress, we call them air beds and water beds, and some call it repo mattress.
Yeah, very comfortable.
Very comfortable for the patient. The patient can never have sores on those beds. But you go to hospitals, you see beds as hard as this floor, because the beds have stayed there for 30 years. Some even have bugs on them, So when you have issues like that in hospitals, it doesn't speak well.
Exactly.
Some hospitals don't have drip stands.
They tie it to a window.
They tie. Thank God they have seen it now.
Even this vein finder you're talking about, like me, I don't know, the way my body is, it's very difficult to find
a
vein on my body.
Yes.
So they have to prick me multiple times. Multiple times.
Is it supposed to be so? The person that is pricking you like that, if they prick him like that, will he be happy? He will not be happy now. You understand? Why you have a vein finder, you have solved that problem of multiple times. We have patients, like especially sickle cell disease patients, that are always admitted in the hospital. By the time they go for admission 21 times in 2 months, all the veins in their body have disappeared. You won't find a vein in the body. You understand? So when you have things like vein finder, you have solved the common problem of finding a vein in a patient. The patient is happy. When a patient that has sickle cell disease comes to the hospital, one of the problems and the thing they have at the back of their mind that is giving them fear is how many times will they prick me before they find my vein. That thing alone is very uncomfortable and, it's very disheartening. But what do? We have to use what we have to get what we want. You can't blame the doctor, you can't blame the nurse. If you are pricked 20 times, 21 times, it's because there is no vein finder.
It's because you're in Nigeria.
And because we're in Nigeria. At least I'm sure most of us see videos online where they use a vein finder. Do you see how
it's in other
seamless
country like China.
Even China, the list of their problem in China is even a vein finder. How much is a vein finder? Vein finders are between 400 to 600,000 to get. A hospital is supposed to have at least each ward, each department is supposed to have like 2 or 3 vein finders. And in children too, that children's veins are very tiny and difficult to find. So why can't we have a vein finder? I keep seeing vein finders on television. I've never seen one in real life, to be honest, except those that have their own personal vein finders, that buy and keep for themselves. So that's the problem. Poverty is one of our problems in Nigeria. The government does not want to help. That's the thing.
May God help us. Sir,
It will help us.
You've said a lot of things. Can you introduce yourself to the viewers?
My name is I'm Dr. Udom Caleb Chukwuemeka. I am a medical officer. I went to school. I schooled at Imo State University Teaching Hospital. I'm an indigenous of Imo State, by the way. So I went to Imo State Teaching Hospital. We are unfortunately schooled for 10 years. That's the truth. But many people don't believe me when I say that.
How is it possible?
But
God of strike?
Those that went to my school will understand. Not strike. Not that I failed any exam. But because the school was structured in a way that you have to spend 10 years because of accreditation issues, back and forth issues with having accreditation to write exams, delay in writing exams and all that. So that accumulated in a lot of problems that we had. But now I think the school is getting better now. I think those that are there may stay 7 or 8 years now.
Okay, sir. Yeah. So thank you so much for blessing us with this episode. We've said a lot of things.
My
and
pleasure.
We still have more episodes we'll be working on, but not today.
All right.
Because of time. We'll be talking about sex.
Okay.
Right?
Yeah.
What else again did we even suggest? There were so many topics.
Yeah, she sent me the topics. Yes. I saw some of them.
What are the topics? What are some of the topics? I want the viewers to know what to expect. If you find this really interesting, please indicate in the comment section. If you'd like to see him again, let me know.
Okay.
Just read more. We've talked about it just now. Okay, yeah, we'll be talking about sexually transmitted diseases that a lot of people don't know.
Very interesting topic.
The ones that people know so much about is HIV and hepatitis, right?
Hepatitis B.
Yeah, so there are so many other ones that could be lying in your body right now.
Yeah.
But the symptoms are not obvious. So you think you're fine, but unfortunately you are not. We are going to be talking about it in details.
Sure.
On the last time I sat with someone, he told us about a kissing disease, that you can actually get diseases by kissing,
Yeah, if you have injuries in your mouth, if you kiss someone that has,
the world is making progress so fast, and at the same time too, there are so many things, new things to be bothered and worried about. May God help us. So we are going to be having this discussion in a new episode.
All right.
And please let your friends know about Lucky Udo Experience. We're working really hard to bring these interesting conversations to your mobile phone, and so you have to help us build this platform. Let people know about us. If you find any episode interesting, you can also decide to react to it on your personal TikTok profile or your social media platforms. And as usual, the audio version of this episode is going to be uploaded on Spotify. Go to Spotify right now, search the Lucky Udo Experience. Make sure you follow us there so you don't miss our forthcoming uploads. Thank you so much, Doctor.
Thank you so much, Dr. Caleb.
Really appreciate you, Mr.
Thank
Caleb.
you, Mr. Lucky Udo. I'm very delighted to be here.
It was a really interesting
I never knew your studio was in Abuja.
Yes.
So your studio manager contacted me and said, would I love to be in Lucky Udo studio? I said, of course, why not? That is going to be a very huge pleasure, and I'm delighted to be here.
Thank you so much for granting. I really appreciate. I cannot wait to have more conversation with you. We will be on the Lucky Udo Experience. We can also decide to make even shorter videos as well to create important awareness from time to time. So let's keep this relationship alive. Because there will be so much to be doing. Yeah. Lucky Udo Studio is based in Abuja. Apparently, in the past, I used to travel around the states of Nigeria filming, but at some point, it became too draining, expensive. I know the security situation of the country, so at some point, I needed to start setting up this place. We've already done the work, so people can come here to share important stories, raise important conversations and topics. Enlighten the public, spread awareness, inspiration, and education. So. Thank you so much, guys. At this juncture, we have to say goodbye to you guys.
Bye.
See you guys in the next episode. This episode started with a question, and now we've left you all with something good to think about.
Yeah.
See you in the next episode, and bye.
Bye.